Is skin and fat removal part of ptosis repair? I had ptosis due to aging and weakened muscle. Have always had deep-set eyes, so no extra skin under brows. Had the ptosis repair and the muscle repair is great, but now one of my eyes has a big chunk of skin under the brow, which was not there before. Surgeon says it's not part of the ptosis repair and I'd have to pay to have the extra skin removed. Was never there prior to the surgery, and I feel it should have been included or at least discussed prior to the procedure. Who's right?
Thank you for your question. You submitted your question with two photos, and you state in your question that you had ptosis repair due to a weakened muscle and that you are satisfied with the repair. However, there is a certain amount of skin that is present after the ptosis repair, and that your surgeon stated that you would have to pay to have the skin removed. And you're asking, should it have been done as part of the surgery, or, quote, who is right? Well, I can share with you what I think is the general opinion of doctors in this oculoplastic community, assuming that you did have this procedure done by an oculoplastic surgeon, and I'll explain to you, I think, some of the thought process behind what your doctor is stating without knowing much of the detail, and I can certainly understand your confusion. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Dealing with eyelid ptosis is a significant part of my practice, as well as cosmetic surgery. And in my practice, I don't accept any insurance, and I do see patients who come for ptosis surgery who make the choice to come to a specialist like myself to have the cosmetic elements of their eyelid surgery addressed in addition to the functional. And this is where I think it has to be clarified. And I think that one of the things that I find when patients come to me for examination regarding eyelid ptosis, that there is this unspoken assumption from really generations of practice, where people who had a degree of either dermatochalasis, which is extra skin over the eyes, or ptosis, the eyelid drooping, that was affecting the visual field, would undergo surgery through their insurance because there was a functional limitation. Well, unfortunately, has been a tradition also of abuse of that particular issue, and a lot of times people try to get cosmetic surgery covered by insurance. And of course, insurance companies don't want to do that, and neither do any third-party payer. And that, of course, is a challenging point. I think that a lot of times when people want to have a procedure covered by insurance, the surgeon is going to be limited to doing only what is covered by insurance. And so it becomes actually also an issue when it comes to the hospital or surgery center that they're working in, because the time involved in doing the other procedures that are more cosmetically oriented, it costs in terms of anesthesia time and facility and other factors. Now, there is going to always be a certain amount of controversy with that type of a statement. But when I see my patients and I say to them, well, if your goal is to only lift the eyelid, then you can, the strict definition of improvement is essentially lifting the eye and getting improving vision. Insurance companies don't care whether it looks good or not. And so I think that this is something that could have been discussed with your doctor prior to the surgery. I think that the challenge here is also whether or not your procedure would, in the context of how it would be performed, there are going to be costs. And I think that that's what is somewhat confusing to patients who get procedures covered by insurance, and if they don't like the aesthetic outcome, then they want to get the cosmetic procedure done, but they are faced with dealing with paying for a cosmetic procedure. It's one of the many reasons that I stopped taking insurance many years ago. I think it's if you like the doctor that did your surgery and you feel comfortable with that doctor, I think you should be able to come to terms which can be balanced for both of you. Understanding that there are certain costs to doing surgery, and that doctor's time, etc., have to be recognized, and also about this. What was your discussion preoperatively? If there was a discussion about the cosmetic aspects of your procedure, I think it's very important to have a lot of just clear, full disclosure of what is covered and what is not covered. So I simplified it by simply stating that if nothing is covered when you come to a cosmetic surgeon who doesn't accept insurance, then what essentially I'm doing in my practice is telling my patients that by having my own facilities, by having my own setup, that any type of enhancement I will essentially factor into the cost of doing the procedure. And therefore, it actually is fairly, my patients have more of a sense of security as to what they will get by addressing all the issues, both functional and cosmetic. The tricky part happens when people get procedures done under insurance and then they want cosmetic things covered. So it's not exactly a black and white situation, but I think defining the distinction between functional versus cosmetic is very important, and having this discussion with your doctor it will hopefully lead to some kind of resolution. Otherwise, I think that if you were to go to any doctor to have the upper eyelids addressed, that would be a cosmetic blepharoplasty, and that may itself be the basis to understand that this part of your issue is really ultimately a cosmetic procedure. So I hope that was helpful. I wish you the best of luck. Thank you for your question.